Powered only by the wind and the sun, it's the Medicare for the Lazy Man podcast. The Medicare podcast that blushes with embarrassment. It's a dog-eat-dog world and he wears milk-bone underwear. It's Medicare expert Doug Jones.
Hello, everybody. Welcome to another episode of the Medicare for the Lazy Man podcast. This is the podcast designed with you in mind. What we want to do here is convey the idea that you can approach Medicare, you can be guided through Medicare, and you can come out the other side smelling like a rose. Confidence should be yours. How does one acquire the Medicare confidence? The confidence to address Medicare and address it and come out the victor? Well, one could purchase my book, Medicare for the Lazy Man 2024. If one were to purchase that book, one would go to Amazon.com or BarnesandNoble.com and type into the search window, Medicare for the Lazy Man, and put in the 2024 because you'll wind up with one of the other year's books if you're not careful. And then when you have that book, if you're at Amazon, you're going to have a choice of 4 different editions. One would be the paperback that most people seem to purchase. That would be a paperback with black and white illustrations. If you go to BarnesandNoble.com, you can have that same paperback with colorful illustrations. But if you're at but if you're at Amazon.com and you don't want the paperback, you may want the Kindle ebook, which is very, very attractively priced. You may want the Audible book, wherein somebody else does all the work of actually reading the book and turning the pages and pronouncing the unpronounceable words. Or you may want you may be a show-off, and you may want to purchase the very exquisite and artfully crafted hardcover book at Amazon. That's a $24 item, but it's something that you can give to your friends and loved ones with pride. They may have a birthday coming up, and you might want to, remember Lordy, Lordy, guess who's 40, all those stupid things. Well, you could use the Medicare for the Lazy Man hardcover book as a gift just like that. You can give it to a person who's turning 40 or turning 50 in anticipation of their eventual, at age 65, enrollment in Medicare. So that would get yucks from all the participants at the birthday party that you have attended to gift that book to your friend or loved one. In any event, Medicare for the Lazy Man 2024. After you finish reading the book, you will have my contact information. If you contact me and say, I'm coming up, I'm sneaking up on my Medicare enrollment time, would you assist me? Then my answer will be an unequivocal yes, I will assist you, and happily so. So with that, let's, speaking of assistance, let's find out what Randy is up to today, because I like to assist him in his preparation for this podcast. There are voices going on.
Yes. All of my electronics, surveillance devices are telling me there's someone in my driveway, and I'm looking to make sure that it's not a Medicare Advantage zombie.
That's a frightening possibility, so I hope you find out it's not.
So far it's not. There was a movie years ago called RoboCop.
Yes.
I always envisioned that if there was a Medicare Advantage zombie in my driveway, I'd have RoboCop march out from my third garage and just shoot him.
That would be fantastic. He had a machine gun instead of an arm, as I recall.
Yeah, he did. Absolutely.
Well, do you remember all the videos, the joke videos about the trunk monkey?
Yeah.
Well, that's probably what you need. That's sort of an animal to help protect you in case the wrong type of individual shows up trying to peddle Medicare Advantage to you.
Absolutely. Well, you know something? I have one responsibility that I need to take care of this morning.
That's exactly right. You've got to select from the giant stack of Medicare Advantage articles for our Medicare Advantage Minute. And that's the time of each episode where we read an article about Medicare Advantage in an effort to warn people to stay away from Medicare Advantage. It's only going to break your heart. So, Randy, would you select the article in question, the number of the article that we're going to read today from the plethora of articles that we have available?
This list is so long, I had to look at it for quite some time, but I settled on 23.10.
All righty, that's fantastic. And ironically, that happens to be the last one left in this giant pile of Medicare Advantage articles. So Randy has taken us, he's escorted us right through a very large stack of Medicare Advantage articles. But here's the cool thing, ladies and gentlemen. The world of Medicare Advantage is constantly generating news. So I have a new stack of Medicare Advantage articles warning people about the pitfalls of Medicare Advantage. And we'll be starting those on the next podcast recording. In the meantime, number 23.10 is entitled The Lesson Medicare Advantage Plans Can Learn from the 1990s. The challenges that Medicare Advantage insurers are facing now are not without precedent, according to an analysis by Oliver Wyman. Don't know who that is. I think it's a company because the names are shoved together. In the late 1990s, Medicare Plus Choice, so Medicare Choice, the precursor to Medicare Advantage, faced rising medical costs and lowered reimbursements. According to this company, which is an advisory firm, lawmakers capped reimbursement increases at 2% annually, while health inflation, medical inflation, grew between 5 and 10% annually. That sounds like a losing deal if your increases are capped at 2%. So between 1998 and 2002, the number of Medicare Choice contracts shrank from nearly 350 not 350,000, 350 to 147. Apparently, it wasn't a very popular program. Several insurers exited the program entirely. Insurers that embraced rigorous financial discipline stayed in the program. To avoid pitfalls that led the contracts to shrink in the Medicare Choice era, Medicare Advantage plans need to prioritize margins over growth and plan outbid strategies early. The mindset change is not likely to be easy for most organizations. It's been more than 20 years since this level of discipline was required, and the need to prioritize margin over growth will be foreign, if not anxiety-inducing, to most individuals and teams executing Medicare Advantage operations today. The pressure is building on Medicare Advantage. The time to act is now. Medicare Advantage is entering a challenging period that's likely to cause a shift in competitive landscape. Insurers cannot be paralyzed by indecision. So I have a multi-page article here about what Medicare Advantage plans are going to have to do in order to weather the current storm. Interestingly enough, when I'm almost at the end of this article, there's a paragraph entitled, How Can Insurers Weather the New Storm? Let's see if I was prescient enough to predict what they were going to do. Medicare Advantage has rebounded since the days of BBA and really took off after the Medicare Modernization Act of 2006, which ushered in drug plans and risk adjustment. There are now roughly 720 Medicare Advantage contracts and more than 32 million enrollees, representing 54% of the Medicare eligible population. It's expected that 60% of Medicare participants will be in a Medicare Advantage plan by the end of the decade. Even as enrollment grows, we expect the regulatory and market forces mentioned above will again force a split in the Medicare Advantage payer landscape and a reduction in the number of contracts. Medicare Advantage organizations vying for long-term stability need to transform their operations similarly to how Humana, Pacific Care, and Oxford Health did in the late 1990s, or they're going to be ultimately forced to exit the same way that half of the industry did. So they have some bullet points here. Product planning must be replaced with business planning. Don't know what that means exactly. Research and data must drive decision-making. Well, that's always a good idea. To enable that, planning must start sooner, And number 4, evolved governance and strong accountability are going to be required. All right. Well, I think I've saved you about 10 minutes of boring reading by skipping through that article. Medicare Advantage plans are not a good idea. And if you have the opportunity to accept a Medicare supplement plan, it's going to cost you a few dollars more. If you take my suggestion, it's not going to cost you that much more. And it's going to be a long-term, 100% permanent solution to your Medicare insurance protection. Now, because we've finished with our big stack of Medicare Advantage articles, I knew that we'd have some withdrawal pains, and so this article showed up today, and it is starting off the next round of Medicare Advantage minutes with a bang. So I'm going to read it now, even though we've already done one Medicare Advantage article. Here's the headline: 1 million patients or more, 1 million plus patients are going to lose coverage as insurers and hospitals drop Medicare Advantage. Now, that's the kind of thing that I've been warning you about, and it's going to continue. Apparently, according to this article, it's going to get worse. Let's see what the content curator highlighted for us. Experts worry that older patients could be exposed to catastrophic costs and interrupted access to care. And this article came from Huntsville, Alabama. Libby and Andrew Potter usually ignore the avalanche of Medicare Advantage ads that land in the mailbox at their home in Huntsville. This happens each fall as Medicare's open enrollment begins. But this year, a few days before open enrollment began, a letter arrived from United Healthcare, the company that just lost its CEO to a murder. Actually, I guess we could call it an assassination. This letter informed the Potters that the region's largest hospital system would no longer be considered in-network for the Medicare Advantage plan that they have. The Potters spent the next couple of weeks worried and unsure about what to do. It seems incredible that 14 area hospitals, including the area's only level 1 trauma center, could suddenly become much more expensive. Now, that would happen if they had a PPO and they went to the out-of-network facilities for treatment, in spite of the fact that their costs are going to be much higher out of network. But I digress. Medicare is the federal health insurance program. Yeah, we know that. Medicare Advantage is a version of Medicare run by private insurance contracts that contract with the government. These plans typically offer extra benefits, the same old routine. We hear this description many, many times. They include some extra stuff that isn't included in Medicare. More than half of eligible Medicare beneficiaries get their coverage through Medicare Advantage plans. But this year, as Medicare's open enrollment season kicks off, more than 1 million patients will have to shop for new health insurance. Facing financial and federal regulatory pressures, many insurance companies, are pulling their Medicare Advantage plans from the counties and states that they've deemed unprofitable. The participants in these plans are faced with either paying the increased cost of out-of-network plans or out-of-network treatment, or rescheduling their necessary medical services with another provider who may not have prompt availability. When a contract leaves the market, that can threaten continuity of care and access to care, says a professor of health services at Brown University School of Public Health. The beneficiary will have to choose a new plan, and each of those plans is going to have different benefit structures, different provider networks, a different prior authorization policies, and different drug formularies. The worry is that it's going to affect their out-of-pocket costs, expose them to catastrophic spending, or compromise their access to care. Insurance giants such as United Healthcare have been aggressively pushing enrollment in their Medicare Advantage plans for the past several years, luring customers with perks and bonuses not available through traditional Medicare. These plans tend to have low or even zero monthly premiums and offer extra benefits, and yeah, we've been down that road, we know that. But there are trade-offs. Medicare Advantage plans often have a limited network of hospitals and physicians. And while the premiums are typically low, enrollees could end up paying much more in the long run in copays and deductibles if they develop a serious illness. Medicare Advantage programs also are more likely than traditional Medicare to require prior authorization for hospital stays and other high-cost services. A congressional investigation by the Democratic Senate staff released this month, for example, I think that was probably September, for example, found that the nation's largest Medicare Advantage insurers denied 25% of all prior authorization requests. How is that? To kick your clients in the teeth, at least 25% of them that are requesting prior authorization for needed medical treatment. This would be requests for post-acute care in nursing homes, rehab hospitals, and long-term care. This year, the handful of insurance giants that dominate the Medicare Advantage market have said that they're scaling back or eliminating plans to shed members and boost sagging profits. They blame new federal changes on their reimbursements, including a small cut to their base payments. And they say their patients are using more medical services and benefits than they anticipated. Though most companies haven't released data on specific counties where they're making cuts, plans are reportedly shuttering in states such as Alabama, Massachusetts, Missouri, New Hampshire, New Mexico, Texas, and Vermont, affecting hundreds of thousands of older adults. Experts say the reasons why a company might find certain markets unprofitable are complex, but they can include demographics, availability of providers, and plans that are already on the market. The industry broadly is going to be trimming benefits and in some cases significantly and exiting from certain counties that are not profitable. They may have not announced publicly which counties will lose Medicare Advantage plans, but noted that their changes could push out 10% of their membership, meaning up to 420,000 patients, could be forced to shop for a different plan. And I skipped a paragraph there. That's executives at CVS Health, Aetna's parent company. That's what they've announced for shareholders and their Medicare Advantage plans for 2025. Meanwhile, at least 28 health systems in 21 states have stopped accepting some Medicare Advantage plans this year, according to an analysis from Becker's Hospital Review. Health systems have cited delayed reimbursements, cumbersome prior authorization requirements, and high rates of patient claim denials for their decision to stop Medicare Advantage plans. Nearly 1 in 5 health systems stopped accepting one or more Medicare Advantage plans last year. So these potters that we opened the article with are losing access to trusted doctors and hospitals can mean going longer without needed medical care. Finding a new doctor, getting an appointment can take months, particularly for specialists. And for older adults living in rural areas, losing an in-network hospital or physician can mean choosing between a long drive for care or higher out-of-pocket cost. There really are important access to care issues when providers no longer contract with your Medicare Advantage plan. Well, that's something to put the cork in the bottle, as it were, for our Medicare Advantage Minute for today. And I'm going to say it's time for us to take a break and go for commercials right now. All righty. Pretty exciting stuff, wasn't it? The commercials or the Medicare Advantage? I don't know which one I was more excited by, but I'm going to keep this Medicare Advantage article. When I hear things like 20% of all hospitals have refused to accept some or all Medicare Advantage plans available in their areas, that's telling. That number is kind of frightening if you're a Medicare Advantage aficionado. How about something a little more enlightening, a little more happy? I have a letter here from a gentleman I'd never seen or talked to before. And he says, "Hi, Mr. Jones. I always like to read the emails from people who call me Mr. It's very, very nice that some people are still using polite terminology in addressing their elders. And believe me, all of these Medicare enrollees are younger than I am. That's for darn sure." So he said, "Hi, Mr. Jones. I read your very helpful book, Medicare for the Lazy Man 2024. Please let me know what you think makes the most sense for me. I was born in August of 1955, and I worked full-time up until April of 2023. I live in New York, zip code so-and-so. I have been enrolled in Medicare Since my Cobra expired last year, I'm in good health and take no medications. And I said, thank you for writing, sir. I have one suggestion to offer and one roll of the dice for you to consider. Oh, when I turn the page, I find that he's listed the products that he has right now. He says, my current monthly payments for my Medicare premium bill are Part A, nothing. Nobody that has 10 years of work experience, taxable employment in the United States, pays anything for Part A. Part B, which is the Part B of Medicare, he's been paying $174.70, and that is going to go to $185 in 2025. And then his IRMA is another $174.70. Can't do anything about the IRMA because he's been successful in the past. He's earned enough money that when he pays taxes, when his tax return indicates a high level of earnings, the government comes out and slaps him with an IRMA penalty. His drug plan IRMA is $33.30. So he pays a United Health premium of $240.85. He said, I'm not sure if it's a Medicare Advantage or a Medicare supplement. I just don't know. And he also pays $3.70 for his WellCare prescription drug plan. And he is informed that that cost is going up tenfold to start in 2025. 10 times they're going to charge him the premium that he's paying now. And so I went to work with a pencil and I sharpened that pencil and I did some ciphering. And I said, thank you for writing, sir. I have one suggestion to offer and one roll of the dice that you might consider. If the product you have purchased for a monthly premium of $240.85 is a Medicare Advantage plan, you have 1 week left to escape from it and to execute my suggestion. I will make it happen for you, of course. If your current plan is a Medicare supplement plan, on the other hand, you may make this change at any time of the year. My suggestion is to purchase the High Deductible Plan G. In New York, where you live, that's known as G+. The monthly premium for you would be $72, a savings of $168.85 per month, or a total savings of $2,026 for the year. In exchange for the lower premium, you would have some limited cost sharing to pay if you needed medical treatment during the year. This would consist of an annual deductible of $257, which you may have already if you have a Plan G, plus 20% of outpatient medical expenses until you have paid $2,600 out of pocket, after which the plan pays 100% for the rest of the year. If you needed no medical treatment, you would pocket the entire savings of over $2,000 to use against future years' cost sharing if necessary. If you want to exercise that change, I will help you accomplish that in short order. The gamble, I remember I mentioned there was a change he could make, and then he could roll the dice on another part of his his Medicare coverage. The gamble involves placing some faith in improving economic conditions. In almost every location in the U.S., your drug plan WellCare value script has a $0 monthly premium. As you know, that plan, along with your IRMA, will be substantially more expensive in 2025 because of your residence in New York. The lifetime late enrollment penalty will be about 40 cents for each month that you don't have a Part D plan. You might consider the current cost for the next 12 months against the possibility of $4.80 monthly for a lifetime penalty if you decide to purchase one of these plans a year from now. If you were to go without a plan for 2 years, then purchase one, the penalty would be $9.60 or so. This suggestion involves a little bit of risk and faith that certain circumstances will improve, and maybe the new regime will eliminate the penalties. Who knows? So that was my suggestion. If he's paying way too much money, he doesn't take any drugs. He pays $3 in 2024 for a drug plan. That same plan is going to cost him $37 next year, and his IRMA is going to be a certain amount of money, $33.30 tacked onto that. He's going to be paying $70 a month for a drug plan. I'm thinking he might want to go without a drug plan since he doesn't take any drugs for a year, in the hopes that the drug plan arena becomes more palatable and the drug plan do not have to charge so much money, and maybe maybe his earnings will subside a little bit, reducing his Medicare IRMA penalties. So I said, it sounds to me like you have come up with some reasonable conclusion. Oh, he must have. He said, okay. I like the idea of the Plan G Plus for $72 a month. That's High Deductible Plan G. Also, if there's no better option than WellCare for prescriptions, it seems like I should continue with that plan. I don't use any prescription drugs, but it seems like something always comes up. Are vaccinations covered by my WellCare plan? Some vaccinations are. And somewhere there's a list of the vaccinations that are covered by your Part D drug plan, and it's fairly sizable. So I think he's going to be happy that if he needs vaccinations, he's going to be happy that he kept that plan. So that was this gentleman's question and my answer, and he decided to go ahead and purchase the High Deductible Plan G to reduce his outlay for Medicare supplements, and I think he'll be pleased with that. Another correspondent. This is from a woman who has an office along Camelback Road in Phoenix. It's on the border between Phoenix and Scottsdale. It's an area that I spent my youth in when I'd come out to Arizona. My grandparents lived in a magnificent neighborhood called Arcadia, and it's still magnificent, although it's made out of 1950s ranch houses. They still look beautiful, and it's one of the few areas that has grass lawns everywhere. And so a guy comes along from the city once every 2 weeks and opens a valve and floods your lawn. It's called flood irrigation. You don't have sprinklers buried in the grass like in other areas. They just come along and give you as much water as your lawn wants to drink. So the correspondence starts, "Hi, Douglas. We just realized since my husband, Bobby, already takes Social Security, he will be automatically enrolled in Medicare Part A and Part B. We don't need him to be enrolled in Medicare because he's still on my company's health insurance. He'll be 65 in January. Do you think there's still time for him to unenroll into the automatic enrollment process?" And I said, "No problem at all. Just a little inconvenience. The Medicare enrollment packet includes a reply card," and I spelled it replay, "a reply card allowing him to refuse Medicare at that particular time. Now, he is able to rescind it, but they usually insist upon having a chat with people who want to do this so that they can stress the seriousness of that decision. Unfortunately, this means he is going to have to speak to someone, and I think your local Social Security Administration office would be the place to start. It's probably time to give them a call. Good luck." And she said, "Thanks very much. We didn't pay attention to any of the mail that came in regarding Medicare." "Well, you're in the vast majority, madam." "Our mistake," she said. "We will call the Social Security Administration on Friday morning." This was last week. And I said, and she said, "Hope you have a wonderful Thanksgiving." And I said, "Same to you. Let me know how it works out." And she later wrote and told me that they have a form for people who want to suspend the Part B of Medicare so they don't have to pay the premium for Part B of Medicare while they are covered under an employer health insurance plan or the spouse's health insurance plan. And so that form is something that they filled out right away and sent into their local Social Security Administration office. And now they are happy as little lobsters. I think lobsters are probably happy. I'm going to read one more short thing before Randy pulls the plug on this whole operation. I wrote this. I'm starting to wonder what this is in my pile of things to read about. Oh, this was interesting. This was a couple who contacted me after reading the book. And the husband said, "I made my wife read your book too, both the last year's and this year's." And they said, "Medicare is a complicated topic." Oh, this is the review they left for the book. I kind of twisted their arms and I said, if you want to go leave a little short written review, I would appreciate it. So this is the review that's on Amazon.com. Medicare is, and this is 100% true because this is the first thing they told me when I spoke to them. Medicare is a complicated topic. This book does a great job of making the subject easy to understand. It also reduced my anxiety about choosing a plan. Instructions are detailed and point by point. My husband and I emailed the author, that's me, with some questions, and he was very responsive. In the end, we felt so comfortable with him, we went through him to process our enrollments. Heads up, we tried to buy the High Deductible Plan G Medicare supplement in Connecticut with another agent. That agent actually told us that it was not available in the state of Connecticut, but it is. Doug Jones knows his stuff. Thanks, Doug. Yep, here again is another agent caught lying, bold-faced lying, caught red-handed, telling a customer a lie about a product that they don't want to sell because they don't make enough money from it. They wanted to sell a much more expensive product to make that much more money in commissions. And Randy, I would say with that, I've executed every article I intended to talk about today.
Cool. Well, I got a question for you.
Please ask.
You know that prior couple that you were just referring to, was that lying agent's name Pinocchio?
Should have been. That nose was probably bumping into the telephone while he was talking to them.
Yeah. Why do people do that? They're always going to get. They're always going to get caught.
There's a big company. Well, it's actually WellCare, has 3 drug plans. They announced last year that they were not going to pay commissions for one of those drug plans. And they said, you can do what you want, but we're not paying any commissions on this drug plan anymore. Later, I talked to a client who called a big Medicare insurance agency in Fort Worth, Texas, well-known agency. And she said, here's the plan I want. I've already done my research. I've decided I want this WellCare plan that's the cheapest one of their 3 offerings. And the agent she talked to said, we don't have a contract to sell that plan. We can sell you the other 2 WellCare plans, but we can't sell you that one because we don't have a contract. Now, that's complete crap, because when you have a contract with WellCare, you have a contract for all of their Medicare drug plans. So once again, and I can cite a few other lies that agents have told, but why bring everybody down? Why harsh everybody's mellow, huh?
Well, I totally agree with you. I had a couple other things I was going to talk about, but to your point, let's end this on a verbal, if not an electronic smile. I've got a few things that I always want to take care of before we sign off, because, the quarters are running out. Doug just can't get that pushed through the board of directors. I don't know why.
If somebody would remind me ahead of time, maybe that would help.
I know. So anyway, grab your pencil, people. If you want to reach out to Doug, you can do so at dbj@mlmmailbag.com. Don't forget, he is licensed nationwide to help you with your Medicare supplement planning. Check us out at the website, MedicareForTheLazyMan.com. Keep checking. We're just about to roll out a brand new shiny one, and I like it, even if I do say so myself. We would also appreciate it. Drop a review or 2 for us on your wanderings through the wilds of the internet this holiday season. The numbers mean everything to us, and we definitely want to finish ahead of the travel logs. It's just bizarre that we are in competition with the travel logs, but we are. Someday, Jug will remind you why that is. Number 4, last but certainly not least, thank you for joining us today. You could have been anywhere else doing anything else, and you weren't. We had you with us, which is exactly where we like to have you, with Doug Jones. But I know darn well you weren't checking your watch. You have just spent about 32.5 minutes with Doug Jones, the anti-insurance insurance guy, originally from Oklahoma. No more. He's up in the high altitude mountains behind Cave Creek, Arizona, next to a mountain range that's very little known. It's very secret. The Nosebleed Mountains behind Cave Creek, Arizona. And we're going to put him in today. I always measure it before the episode. I'm going to put him in at an altitude of about 12.5.
Talk about bleeding noses. I'll tell you right now. Thank you, ladies and gentlemen. Thanks for joining us. And thank you, Randy, for engineering this extremely complex podcast. I appreciate it. And we'll be looking for everybody to return again for another episode very, very soon. Bye-bye.